I'm going to be talking about our experience with this brand new module called the Independent Study Option, and we've run this for the first time during the COVID pandemic. So I just want to talk about what diagnostic radiography is in the first instance, just in case there's anyone that's not aware. So diagnostic radiographers use a variety of different medical imaging techniques to diagnose different conditions. So we might use radiation to produce X-rays. We've got computed tomography scans, we've got nuclear medicine scans, magnetic resonance imaging, ultrasound, and interventional radiology, just to name a few different techniques there. And we work in a variety of settings, so A&E, theatre, specialist trusts, neurocentres, cancer imaging, as well as wards. So many patients will pass through the radiography service as part of their diagnosis or treatment. And diagnostic radiographers are regulated by the Health and Care Professions Council, and our professional body is the Society and College of Radiographers. And last year, 2020, just happened to be the centenary year of the Society and College. So just for a little bit of extra interest, several of the PowerPoint slides have got a zoomed in version of one of the emblems within our crest of the Society and College. So just have a think about what that might mean to radiographers as we go through, and I'll reveal the answers at the end. So Health Careers NHS has this to say about radiography, and the focus here you'll see is on advanced technology. And for radiographers, it's really important that we keep abreast of this technology, because technology is ever changing, moves on very quickly, and we need to be continually updating our knowledge. So it's important that we instill this in our graduates. So here's our first zoomed in elm part of the crest, this emblem. So we've got an owl there, so have a think about what that might mean to radiographers. So in terms of developing 21st century practitioners, these are some of the areas that we need to be thinking about. We need to be aware of new technologies and their application, and that employability is obviously a feature of Strategy 2026, as well as the professional aspects. Because we're working with radiation, we need to be very safety conscious and obviously patient focused, and the clinical elements of our courses play a big part in this, in integrating theory and practice. We need to be able to interpret image data, so understanding what the abnormal versus normal appearance of different radiographic images looks like. And we need to be able to communicate well with both patients and our professional peers. The motivation and autonomy are all important parts for any professional. If we just have a look here at the demand for imaging, and this is in the 5 years pre-pandemic. So this grey area here, this is the general NHS demand, which was going up at about 3% over that 5-year period. And this is the demand for X-ray here, the orange, so only about 1%. But you can see in comparison the demand for some of these other specialist imaging modalities like CT, MRI, PET-CT and ultrasound has gone up significantly more. And traditionally, it's worth pointing out that diagnostic radiography courses have trained our graduates mainly in X-ray procedures, and they'll experience some of these other modalities, but they don't specialise in these until they graduate, and then they might get further experience and training and specialise in one of these areas. But because of this stark difference, it's important that our graduates are starting to become familiar with some of these other modalities during the courses. So that's what we're starting to think about. And the independent study option incorporates all of these elements. There's our second emblem there. That's a rod with a serpent around it. So this is where the reimagining of the curriculum came in. In 2019, we underwent programme revalidation, and the module design, all of our module designs incorporated hallmarks of Curriculum 2021. So we were looking at having specific discipline-related inquiry and active learning. And in terms of this particular module, it runs in year 2. The students would select a particular imaging modality of interest, and we would arrange 4 additional clinical placement days for the students. That's over and above the normal clinical placements that they would have as part of the programme, but they would spend those 4 days in that modality. They would select a particular pathology or medical condition which they've observed being scanned within that modality, and they would do some research about why the protocol is undertaken in the way it is. They would think holistically about patient care requirements, what the images might look like, And importantly, they will do some critical analysis of where that diagnosis would fit within the care pathway, what kinds of decisions might be made for treatment of the patient. These are all guided via peer seminars where the students would meet weekly with one of their academic supervisors. Assessment was through an assignment and a presentation, and this gave some authenticity because it was a specific application of knowledge to a particular patient pathway, and the presentation also helped to develop the communication skills which are expected of our graduates. There's our third emblem there, that's a white cross on a black background. Due to COVID-19, we did need to revise the planned format of the module. And this is mainly around the problems that we knew we were going to have with arranging the clinical placement days. This is due to the pressure that was on the NHS Trust, obviously, throughout the pandemic. And so what I asked the students to do was to select a first and a second choice for their modality. And then I could then approach the placement trusts to see whether they could actually accept the students for those 4 days. And I'm pleased to say, for nothing short of a miracle, we managed to get most of the students their first choice, which was fortunate. So we managed to sort the clinical days for them. The handbooks were all available online for the module, and the reading list was all ebooks because I knew that the students wouldn't be able to get to the library. The seminars needed to be all run online, but the students engaged very well with that, and this gave them some guidance for completing their assignment. They had some targeted preparation that they needed to do in advance of each seminar. We had a presentation skills lecture and some know-how resources for presentation skills. They were able to do a formative presentation in the final seminar. And this was really helpful because the presentations would ideally have been undertaken in person, but again, we needed to do those online. So as well as being nervous about presenting, the students needed to learn how to be able to present via Zoom. So having that formative presentation was really helpful for them. We had regular assessment drop-ins where students could come and ask any questions. And then the summative assessments, the assignments were submitted via SpeedGrader in Canvas, and the presentations were marked using a rubric that we set up in Canvas. And because Canvas was very new to all of the staff as well, this is a big learning curve for us alongside the students. I'll just show you some of the examples of different student topics. Oh, there's our fourth emblem, the sun. So these are some of the topics that the students chose. So I'll just carry on talking while I'm bringing all of these up. So the students seem to engage really well, and you can see that they developed some very interesting topics. It was lovely to see how well they engaged with it and some of the range of topics that they came up with. And the higher achieving students were those who gave the full regard to the management aspect. So not just the diagnosis, but the management aspect of the patient pathway and the more holistic elements. And this was some of the student feedback. So it was clear that the students enjoyed the independent choice of topic, and this enhanced their motivation. They still did need some guidance and support, but they did appreciate the seminars and the guidance that they were given. And I'm really grateful to all of my colleagues in Diagnostic Radiography for engaging with the module and supporting the students with this through the seminars. Some of the things that students felt could be improved, some of them felt the clinical observation days were too many. They didn't think they needed that many days. The timing of some of them was a challenge, fitting them in around other student placements. The students felt there were too many other students. They couldn't always get into the areas that they needed. And COVID inevitably caused some problems. Some of the examination rooms were quite small, so there were limitations on the numbers of staff and students that could be in the room. So that caused us a bit of a problem. There's the final emblem there. I don't know what your Latin's like. So reflecting and revising, what have we learned from this? So I think what our experience has really supported what we already knew from the evidence. So there was already a lot of evidence around the benefits of independent learning in healthcare, professional competence transition to practice, peer learning and formative feedback. And all of our experience from this module has demonstrated that, that evidence base is sound. The presentation and communication skills, we were really impressed with the students' approach to this, in particular, the way they embraced the Zoom presenting, the effort that they put into their presentations, and a really good range of marks, which clearly enable different levels of ability to be identified. The presentations worked really well to enable the students to verbalise their additional knowledge and demonstrated their depth of understanding as well through some of the questions that we were able to ask them. The clinical days, as I said, did lead to active learning, but the format will need some revision for next year. So that's something that I'm looking at. The employability and career decisions. This is still a bit of an unknown. Students picked modalities that they think they would want to work in, but it would be useful to further explore whether their perception has changed or whether that's been confirmed from undertaking this module of study. So the next steps are going to be to review this and using a further exploratory study, hoping to do some focus groups in September to try and engage the students' opinions on those. Okay, that's the end, and there's all the meanings behind all of those emblems in the crest. I'm happy to answer any questions.
That's fantastic. Thanks, Vicky. And a Latin lesson thrown in as well.
Yeah, I hope yours is better than mine because I didn't have a clue, but I do like that. I'd like that quote, "From a shadow cometh knowledge."
That's great.
I like any opportunity to promote the profession.
Absolutely. Jeremy.
Thank you, Victoria. That was really interesting. Just quite a basic question, really. If I understand correctly, the students went through online seminars and they also had an assessed presentation. Is that right?
Yeah.
Did you pick the same platform? I think you mentioned the assessed presentation was on Zoom.
Yeah.
Was it the same platform for the seminars as well?
Yeah, good question. We actually started off doing the seminars via Teams. But then as we carried on through throughout the module, and we were using obviously electronic formats for other modules as well, we realised that Zoom was a bit more stable for that. So we decided that we would do the assessments through Zoom rather than Teams because there was a lot of problems with connectivity with Teams, and Zoom seemed to have less of those. So when the students did their formative presentation, we used Zoom for that. So even though we'd been using Teams for the previous seminars, we all used Zoom for the final one, just to give them a bit of experience of presenting that way.
The reason I ask is because I had a similar experience in semester one.
Oh, right.
Because my students were being assessed on a presentation, and I made the decision to use the same platform for lots of their other project work leading up to the final presentation, so that they felt comfortable on that platform.
Yeah, it's definitely been a big learning curve, and I think if we were doing the same again, we'd probably try and use the same format all the way through. We realised that quite late in the day, but at least we did realise it in time.
Thank you.
Thank you for that.